Welcome to Medicine Handy Point. Today we are discussing macrocytic anemia. Macrocytic anemia is when the MCV is raised. So, that is called macrocytic anemia. The next step is to do the peripheral smear. Peripheral smear is very important. So, if the peripheral smear is done and the peripheral smear shows that the patient is having hypersegmented neutrophils, then if what are the hypersegmented neutrophils? If the neutrophils have more than 6 lobes of nucleus, then they are called hypersegmented neutrophils, and it indicate megaloblastic anemia. So do vitamin B12 and folic acid deficiency. So easy, we do vitamin B12 and folic acid level and we diagnose megaloblastic anemia. On the other hand, if the peripheral smear shows that there are no hypersegmented neutrophil, then it is called non-megaloblastic anemia, and the causes could be multiple. So what could be the multiple causes for it? It can be a liver problem, thyroid problem, dyslipidemia, alcohol use, or drugs. This was a brief presentation about the macrocytic anemia workup. I hope you liked the video. Thank you.